President Donald Trump recently floated the idea of giving Americans straight up cash to pay for healthcare instead of extending premium subsidies through Obamacare. So let's talk about the many reasons why that is a terrible idea. First, let's get the obvious objections out of the way. Would the administration simply send people checks through the mail? If so, who's to say this money will be going toward healthcare and not, say, a new flat screen TV? Second, these checks are going to have to be huge to be of much help. As it is, Americans have spent an average of $1,425 in 2022 on out-of-pocket healthcare costs, and that includes people who have insurance. Giving people cash instead of health insurance could mean thousands of dollars per household, which is absolutely unaffordable for the federal government. Let's just say the government sent $1,425 to everybody in America to cover out-of-pocket costs alone. 340 million people times 1,425 equals $484.5 billion for a single one-time payment. But the biggest problem with Trump's idea is that it fundamentally misunderstands how insurance works. Insurance works because each of us contributes premiums to a larger pool of money, which then goes to pay for claims for people who are sick. The bigger the pool, the lower the costs, especially if there are younger, healthier people who won't be making claims. Now, if you're young, you might be wondering, why should I pay in to pay for someone else's bills? It's true that in many years, maybe you're not going to get back what you paid in. But if something terrible were to happen, other people's premiums are going to cover you. Your premiums are also helping to pay for people like your parents. And someday, younger people are going to subsidize you. That's actually the same principle behind Social Security. Younger people who are working help pay it forward to older generations, and they, in turn, someday will get the same treatment themselves. It's all about working collectively to protect each other. Trump's idea breaks up the societal bargain so that instead of us working together, it's every person for themselves. I guess it's not surprising. Now, if Trump offers people cash to pay for healthcare, some group of people will decide that they don't need to be insured. They'd rather have the cash. And the people most likely to make that decision are the younger, healthier people who feel they can afford to take a gamble on going uninsured. That means the pool of people who have insurance will shrink. It also means that the people buying insurance are the ones who think they'll need it, meaning older people or people with chronic conditions like diabetes or cancer. So the people left in the pool are going to have to pay a lot more for their insurance, while the people outside the pool are unprotected if something happens. That is why experts say that Obamacare would actually collapse under Trump's plan. It could also send healthcare costs higher. Trump's idea is not a plan. It's not even a concept of a plan. But if Republicans go ahead anyway, Americans are going to find themselves a lot worse off. I'm Ann Kim. Thanks for watching.